Hello my dear students. Today I am going to talk about the anatomy of the brachial plexus. First I'll talk about its basics and the structure of the spinal cord. What is the role of the ventral rami of the spinal cord in formation of the brachial plexus and in the innervation of the human body? What is the role of the ventral rami? That's very important. Then I'll talk about the formation of the brachial plexus through the roots, trunks, division and chords from where these terms have been derived. After that, I'll come to the branches of the brachial plexus, the nerves coming out of the brachial plexus. And then I'll talk about the nerve distribution scenarios, how you will solve the question about the nerve distribution. This is the part 1 of my lecture. Part 2 of my lecture will be about the complete upper limb innervation in a simple and an easy sequence. How you will make an easy concept about the nerve supply of the muscles and the nerve supply of the skin. That is the motor innervation and the sensory innervation. Listen carefully and note down these facts over your notebook. Things will be very simple after that, and the concepts and the understanding will be long lasting after that. Hopefully it will help you a lot. So let's start our lecture now.
First of all, let me show you simple structure of the spinal cord. Spinal cord has grey matter, and around grey matter it has got the white matter. Grey matter has got the neuron cell bodies, and white matter has got the fibers of the cell bodies. So this is the spinal cord, and from here two roots emerge. One root has got a swelling, that is the dorsal root. This is the swelling. On both sides we will have a dorsal root that has got a swelling. This one is the dorsal root, and then the motor root or the ventral root that hasn't got a swelling, that is smarter. This one is the ventral root. Okay, dorsal and ventral root join for a distance to form the spinal nerve. This one is the spinal nerve. This one is the spinal nerve. Spinal nerve immediately divides into two, into a minor ramus, that is the dorsal ramus, and into a major ramus, that is the ventral ramus. This is the minor dorsal ramus, whose target area is very much small, and this is the ventral ramus, whose target area is very much larger. If you draw a line in the center, we will have a structure over the posterior aspect. They will named as dorsal parts of the spinal cord, and over the front we will have the structure that will be labeled as the ventral parts of the spinal cord and spinal nerve. So look at here, this is the grey matter horn, this is the dorsal horn of the grey matter, and this one is the ventral horn of the grey matter. Here we have got the dorsal white matter, here we have got the ventral white matter. This root that has got a swelling is present over the dorsal aspect. This is the dorsal root, and this root that is smarter over the ventral aspect is the ventral root. This is the ramus over the dorsal aspect. This is the dorsal ramus, and this is the larger ramus over the ventral aspect. So this is the ventral ramus of the spinal nerve. I repeat, we've got a grey matter of the spinal cord that is present in the center. It has got four horns, two dorsal horns, which are the sensory horns, and two ventral horns. These are the ventral horns, which are motor horns. Round the grey matter we have got the white matter. This is the white matter. So this is the spinal cord, and this is the limit of the CNS. These roots are not the part of the central nervous system. These are the parts of the peripheral nervous system. So this one is the dorsal root. Here is the dorsal root, and here is the ventral root. This one is the ventral root. These two roots join to form the spinal nerve. This one is the spinal nerve that is formed by union of the dorsal root and the ventral root. This is the spinal nerve, and we define spinal nerve like it is the nerve that is made by union of the dorsal root and the ventral root. After the formation, spinal nerve immediately divide into a minor dorsal ramus. This one is the dorsal ramus, and major ventral ramus. This one is the ventral ramus. Also note down that dorsal root is pure sensory and ventral root is pure motor. Dorsal root is pure sensory, ventral root is pure motor. When these two roots will join, we'll get a spinal nerve that is mixed. And after that, whether it is the dorsal ramus, whether it is the ventral ramus, both are mixed. So I will repeat, we've got a dorsal root that is pure sensory, and we've got a ventral root that is pure motor. These two roots will join to form the spinal nerve that is mixed, and spinal nerve will divide into a minor dorsal ramus that is mixed and a major ventral ramus that is also mixed. These are the very basic concepts about the anatomy of the spinal cord and spinal nerve, so always keep in mind and never get confused. Now look at here, this is the cross section of the human body showing the body wall. This is the body wall, and here we have got the vertebral column or the vertebral canal where spinal cord will be placed. Let me show you. Okay, now this is the spinal cord and spinal nerve with all its parts. I'll show you how this will fit inside its location. Look at here. So in this way, spinal cord will be present inside the vertebral column, and from the spinal cord we get the dorsal root and we will get the ventral root. These two roots will join to form the spinal nerve. This is the spinal nerve. From here, the spinal nerve will divide into a minor dorsal ramus, a minor dorsal ramus, and a major ventral ramus. This one is the major ventral ramus. The target of the dorsal ramus, the distribution of the dorsal ramus is just the part of body here, and we can say that this is the back midline. Thus this part of the body wall will be supplied by the dorsal ramus. Dorsal ramus will not supply the whole back. Keep in mind, dorsal ramus will not supply the whole back. The rest of the body will be supplied by the ventral ramus. Ventral ramus will travel to the side and to the front of the body. I repeat, the rest of the body will be supplied by the ventral ramus. The ventral ramus will travel to the sides and to the front of the body. In this way, the ventral ramus will supply the rest of the back, the side of the human trunk, and the front of the human trunk. In the region of the upper limb and lower limb, this ventral ramus will move out of this area and will supply the upper limb and the lower limb. Upper limb and the lower limb as the brachial plexus and the lumbosacral plexus. So keep in mind, the source of the brachial plexus, lumbosacral plexus, source of the nerve supply to the upper limb and the lower limb is always the ventral rami of the spinal nerve and not the dorsal ramus. Now I'll quickly repeat what we have learned so far in this sketch. This is the spinal cord, then we have got the dorsal root and the ventral root, then we have got the spinal nerve that divides into dorsal ramus. Dorsal ramus supplies the back of the body wall only in the center. Rest of the job is done by the ventral ramus, that is the rest of the back, the side of the body and the front of the body wall. Also, the ventral ramus is the source of nerve supply to the upper limb and the lower limb. There is no contribution from the dorsal ramus. Upper limb and lower limb plexus are brachial plexus and the lumbosacral plexus. Their formation is contributed only by the ventral ramus. This is very important point, very basic point. Whenever you are asked about the root value of the brachial plexus or the root value of the lumbosacral plexus, you will say ventral rami of these nerves. I will explain shortly. Look at here. Now I will explain the fact why we need plexus in the limbs and why not a typical spinal nerve. Look at here. This is the typical spinal nerve that is distributed in the body wall like this. We have got the typical spinal nerve distribution in the body wall. This typical spinal nerve distribution doesn't suit in the limbs. Why? Because in the limbs, we have got the unequal proportion of the muscle mass and the skin. Here we have got more muscle than the skin. But in the body wall, you can see we have got equal distribution of the skeletal muscle and overlying the skin. Where we have equal distribution of the muscle mass and the skin, we can deal this area with the typical spinal nerves at the regular intervals. These are the typical spinal nerves at the regular intervals. But in the limbs, we have got the plexus. Muscle mass is much higher than the skin here. So, this part of the body cannot be innervated typically like this with 1 or 2 spinal nerves. Here, we require 5 spinal nerves. And here in the lower limb, we require 9 spinal nerves. Therefore, the ventral rami of the 5 spinal nerves is assigned to innervate the upper limb. From here, they will move, they will converge, they will get mixed, and then they will move towards the upper limb. Like in the lower limb, we have got the lumbar plexus and we have got the lumbosacral plexus. That is the mixing of the 9 spinal nerves. After the mixing of the 9 spinal nerves, the nerves will move towards the lower limb and they will supply the lower limb. The spinal nerves get mixed in the plexus, and after mixing we get the peripheral nerves like radial nerve, musculocutaneous nerve and the ulnar nerve. These peripheral nerves are mixed and have got fiber from multiple spinal nerves. This kind of innervation is much more beneficial for the limbs and we can avoid the injury to a single spinal segment. And now I'll talk about the formation of the brachial plexus. Brachial plexus is formed by the ventral rami of the spinal nerve. This is the spinal nerve and this is the ventral rami which will extend further to form the root of the brachial plexus. This is the ventral rami and this will form the root of the brachial plexus. The brachial plexus formation is through ventral rami of the 5 spinal nerves. Hence, we will get 5 ventral rami and these ventral rami will become the roots of the brachial plexus. These ventral rami belong to spinal nerve number C5, C6 and C7, C8 and T1. These are the roots of the brachial plexus. From the roots we will get the trunks and we have got the 3 trunks of the brachial plexus. Upper 2 roots will join to form the upper trunk. Lower 2 roots will join to form the lower trunk. And this middle root will continue as the middle trunk. So these are the trunks of the brachial plexus, upper trunk, middle trunk and the lower trunk. Now each trunk will divide into 2 divisions, hence we will get 6 divisions from 3 trunks. The divisions are anterior and posterior. So we will get 6 divisions through 3 trunks and 3 trunks were divided from 5 roots. So each trunk will divide into an anterior division. This blue color shows the anterior division and a posterior division. The black one shows the posterior division. Blue one are the anterior divisions and black ones are the posterior divisions. After the division comes the chords of the brachial plexus. After the divisions comes the chords of the brachial plexus and through 6 divisions we will get 3 chords. But how? All the posterior divisions will join together and they will form the posterior chord. So this is the posterior chord of the brachial plexus. The anterior divisions of the upper trunk and the middle trunk will join to form the lateral chord. And this last division, that is the anterior division of the lower trunk, will continue as the lateral chord of the brachial plexus. Now I'll repeat all this formation of the brachial plexus. The formation of the brachial plexus is through the ventral rami. This is the ventral rami of C5, 6, 7, 8 and T1. These ventral rami will be now labeled as the roots of the brachial plexus. Don't confuse this root of the brachial plexus with the root of the spinal nerve. That is different. Keep in mind, the ventral rami is now labeled as the root of the brachial plexus. Through 5 roots, we will get 3 trunks. Upper 2 will join to form the upper trunk. Lower 2 will join to form the lower trunk. And the C7 ventral rami will continue as the middle trunk. After this, each trunk will divide into an anterior division and a posterior division. Anterior and a posterior division. We will get 6 divisions in this way. After this, all 3 posterior divisions will join together to form the posterior cord of the brachial plexus. Anterior deviation of the upper trunk and the middle trunk will join to form the lateral cord of the brachial plexus. And this remaining last one, the anterior deviation of the lower trunk, will continue as the medial cord of the brachial plexus. Here comes the important question. Why these cords are labeled as lateral, posterior and medial? What is the reference structure that will label these cords as lateral, posterior and medial? That reference structure is the reference structure of the axilla. In the axilla, we have got an artery, that is the axillary artery. So very simple, a cord that is lateral to the artery will be labeled as the lateral cord. A cord that is posterior to the artery will be labeled as the posterior cord, and a cord that is medial to the artery will be labeled as the medial cord of the brachial plexus. So this is all about the formation of the brachial plexus. Look at this diagram of a tree. Tree has got the roots, then it has got the trunk. After the trunk, it has got the divisions, and after the divisions, it has got the cords. From the parts of the tree, the level of the brachial plexus has been named. Accordingly, you can note down that first we have got the roots in the brachial plexus levels. After the root, we have got the trunk, and after the trunk, we have got the divisions. These are the divisions. And after the divisions, we have got the cords. These are the cords. And from cords, we get the branches. So this is the naming system of the brachial plexus levels. First is the root, then is the trunk, then is the division, then is the cord, and last is the branches of the brachial plexus. And now I show you the branches or the peripheral nerve coming out of the brachial plexus. From the root of the brachial plexus, we get two branches. Number one, a branch coming out of the C5 root. This branch is known as the dorsal scapular nerve. Then second branch from the roots, we get a branch from the root number C5, C6 and C7, and this is known as the nerve to serratus anterior. This is also known as the long thoracic nerve. Similarly, from the trunks of the brachial plexus, we get two branches, but only from the upper trunk. This upper trunk will give us two peripheral nerves. The name is similar to these two names. One is the nerve to subclavius, another is suprascapular nerve. So note down, nerve to subclavius and suprascapular nerve are coming from the upper trunk of the brachial plexus. And now the branches from the cords of the brachial plexus. Keep in mind, we get no branch from the divisions of the brachial plexus. This is the posterior cord of the brachial plexus. From posterior cord of the brachial plexus, we get 5 branches, and for remembering these 5 branches, the mnemonic is ulnar. But keep in mind, not the ulnar nerve. Ulnar means U for upper subscapular nerve, N for lower subscapular nerve, N for nerve to latissimus dorsi, A for axillary nerve, and R for the radial nerve. These are the branches coming out of the posterior cord of the brachial plexus. This one is the medial cord of the brachial plexus. This medial cord is going to give us 5 branches, and the mnemonic is U4M. U4M means U and 4 times M. U for ulnar nerve, M for medial pectoral nerve, then M for medial root of the median nerve, then M for medial cutaneous nerve of the arm, and last is the medial cutaneous nerve of forearm. So these 5 are the branches of the medial cord of the brachial plexus. From the lateral cord of the brachial plexus, we get 3 branches, and 3 branches are the musculocutaneous nerve, then is the lateral pectoral nerve, and then is the lateral root of the median nerve. Keep in mind, median nerve is not coming from a single cord. Half of the median nerve is coming from the lateral cord and half of the median nerve is coming from the medial cord. So these are the branches of the brachial plexus.
Now I'll guide you about the nerve distribution. If you are asked about the nerve distribution in your exam, how you will attempt this question? The question can be give the distribution of axillary nerve or like give the distribution of deep peroneal nerve. How you will solve this question? Always keep in mind you will give two headings. Number 1, the motor distribution. Number 2, the sensory distribution. In the motor distribution, you will just write down the name of the muscles that have been supplied by this specific nerve, only the name of the muscles. And in the sensory distribution, you will specify the area of the skin that has been innervated by this nerve. No further explanation, no need to write down any other detail, just the name of the muscles and just the area of the skin you will write down in your answer. There is no need to write down the course of the nerve, the origin of the nerve, the root value of the nerve, nothing else. Just two headings, motor distribution and the sensory distribution. Now I'll show you some examples. For example, if you are asked about the distribution of the musculocutaneous nerve, you will give a heading of the motor distribution and you will write down the muscles supplied by musculocutaneous nerve. Number 1, coracobrachialis. Number 2, brachialis. Number 3, bicep brachii. And then the heading will be sensory distribution. And in the sensory distribution, you will write down that forearm front lateral aspect is supplied by this musculocutaneous nerve. That's it. This is the answer to this simple question. Next example is distribution of the axillary nerve. You write down heading again, motor distribution, and you write down the muscle's name, that is the deltoid and the teres minor muscle. Then the heading is sensory distribution and you will specify the area of the skin that is innervated by this nerve, and that is area above the deltoid. Skin above the deltoid is supplied by the axillary nerve. Next example is distribution of long thoracic nerve. You will give the heading motor distribution and you write down the muscle, that is the serratus anterior. Then the heading is sensory distribution. As long thoracic nerve is pure motor nerve, it supplies no skin, but even then we'll give the heading of the sensory distribution and we'll write down nil. This will make your answer more accurate, that you clearly know that this nerve is pure motor and the sensory distribution is nil. The last example is distribution of the radial nerve superficial branch. You will give the heading of the motor distribution, but this nerve is pure sensory, this supplies no muscle. We will give heading and we will write down nil, and then we will give the heading of sensory distribution, and in the sensory distribution we will write down the area of the skin that this nerve is supplied. So this is all about the nerve distribution questions, how you will solve it.